In addition to being the Chief Medical Officer for Robomed USA, I'm a practicing robotic surgeon in Charlotte, North Carolina, having done close to 1,500 cases with the robot. We are excited about this joint venture that we have with NISA and partnership we have with Microport, who manufactures the Tumai robot. Tumai means hope of life. So exactly what it means for Nigeria is that now Nigerians have access to advanced surgical care using modern technology that is being used worldwide.
That's an advancement that is welcome because it provides patients with the best care in terms of surgical care, limiting the pain that's experienced from surgery, or improving the outcomes that patients have, and decreasing the complications that are associated with surgery. The robot allows us to see almost microscopically the anatomy so we can preserve all that needs to be preserved. And it also steadies the surgeon's hands so that you're operating in a very precise way. The incisions are very small, so the risk of infection is very, very low. And the risk of bleeding is almost negligible. We were able to start robotic surgery here in Abuja, where the first few cases that we performed here at the NISA Premier Hospital. We did a nephrectomy or kidney removal, the first done in West Africa using a robot. And we did a removal of a prostate for a patient who had prostate cancer. The first patient went home 12 hours after surgery, the major surgery. The second patient who had a prostatectomy went home 48 hours after surgery. And those two patients are doing fantastic.
A core pillar of our objective training, because we recognize that there are over 200 and something million people in Nigeria, and they deserve to get the best care, the modern care that is available to them. And so training is a big part of that, to build surgical expertise within the country to serve the population that we're serving.
We've been able to initiate an academy called Robomed Academy, which will help train the next generation of surgeons to be robotic surgeons. Not only the surgeons, obviously nurses, the bioengineers, and people who are going to be able to actually provide an ecosystem that allows for patients to have access to robotic surgery here locally.
This is a platform that has been utilized many decades in Western countries and in some countries within the African continent. And so it's okay to be skeptical, but I would say you research, you read, and you come talk to us.
We have to be able to train surgeons and nurses and bioengineers so that we can have robots in all the major teaching hospitals, say in Nigeria.